Thank you for tuning in to watch the place of creativity in public health, researchers' perspectives on creating a Midlands network. This event is brought to you by our Midlands Creative Health Associate, Jane Hurst. Special thanks are given to Herefordshire Council and Birmingham City Council, whose Directors of Public Health advocated for more support of creative public health at NCCH. More thanks go to the Director of Public Health at Stoke-on-Trent City Council, who put creative health research on the agenda, and to Jane Povey, who first conceived of a localised network. This roundtable is part of a 4-part series of roundtable discussions showcasing creative health leadership in the Midlands and beyond. To access other event recordings in the series, please visit the NCCH website at www.ncch.org.uk and view our blog pages. Now, without any further ado, let's introduce the panel.
Thank you, Jane, for inviting us to be here. My name is Kathleen Ann Wright, and I'm the Public Health Research Officer in Residence at Midlands Arts Centre, also known as the MAC. So I'm one of the 4 post holders that Justin Verney kind of mentioned in his intro at the beginning. So I'm the newest member. I started in June of this year. So I'm in residence with my fellow officers within the hearts of the cultural assets in Birmingham, such as Birmingham Museum Trust, the Icon Gallery, the Hippodrome, and, as I mentioned, the MAC. So within our unique and exciting roles, we're part of the Birmingham City Council Creative Public Health Programme, contributing to building their health and wellbeing evidence and informing their future creative health strategy. Within our cultural organisations, we're collaboratively investigating the impact of specific areas on public health and wellbeing. So, for example, my colleague Sophie Beckett at Birmingham Museum Trust is investigating the impact of food, culture and oral archives. Regan MacDonald at the Icon Gallery is investigating the impact of visual arts within gallery spaces, community settings and prisons. And Jay Rowe at the Hippodrome is investigating, as Justin mentioned, the impact of theatre on young people's mental health and well-being. So for myself at MAC, I am exploring community dance and music participation, as well as the relationship between green space of MAC's community members, as it's situated in Birmingham's beautiful park of Canning Hill. For example, we'll be doing a research evaluation in end of October on MAC's Big Green Weekender event that will also kind of celebrate the exhibit and launch of Wastage, which is coming from the Design Museum. For me, a key part of this work is working with the community to co-produce outcome measures that really represent what the community value, rather than it being derived from predetermined indicators. An exciting part of also being at MAC is that we're involved in an initiative that's been rolled out by Future Art Centres, which is part of their action research group to be upskilled and trained in the qualitative methodology of most significant change. Most significant change really reframes the way we measure impact, so it's not about how many, it's really asking what the difference is, what has changed for whom during perhaps a programme or intervention, and how. So it's really highlighting, again, what stakeholders value, identifying the factors and mechanisms behind what has happened and occurred during an intervention, and looking past, again, those predetermined outcomes. So overall, the delivery of my role within MAC as a research officer is supporting the development of sustainable tools and guidance on creative public health, building public health into things that they don't currently commission, and connecting really with the local organisations across Birmingham, working within that thematic area of dance, music and green space, as well as, importantly, evaluating and researching. So it's really about championing the role of creativity in achieving equitable health outcomes, improving the quality and relevance of creative public health in general and how we all see it, and broadening the principles, values, accountability, and importantly, the transparency of research. Before starting this role, in 2021, coming out of the pandemic, I was fortunate enough to secure a place within the Creative Health Masters at University College London, which gave me the knowledge and skills to work in this area of community research and creative health. Within that master's, I designed and led a mixed method 6-week forest bathing evaluation project in partnership with the Forest Bathing Institute. So I have a background in evaluating green social prescribing programs, which really was unpicking and understanding mechanisms and barriers to engaging in green space interventions. And alongside this, I was also working interdisciplinary with the University College London and Queen Mary London, assisting the State of the Art of the Review on community-based placements in higher education. And following that, I was honoured to support Rosie Dow at the National Arts and Health Hospital Network evaluation of our National Health Stories, which was really a celebration between 19 hospital trusts collaborating the stories of people who work in the NHS. So yeah, I've had quite a mixed interdisciplinary background, and it's really exciting to be here. Thank you.
Hi everyone, my name is Olivia Toy. I'm an advanced public health practitioner at Worcestershire County Council. My expertise areas are actually also in community engagement and intelligence, but I most recently have also taken part in the Creative Health Mask at UCL, so I've been doing that part-time over the last 2 years alongside working. My background, as I mentioned, around community engagement was more rooted in kind of journalism, third sector public health and communications. But I'm really happy to be able to bring the creative health element into my workplace now as well. Personally, much more interested in kind of nature and well-being. I'm also a beekeeper in my non-work life. And I was really interested to see how we can bring some more creative approaches into public health practice. So throughout the Creative Health Mask, it was actually a really great opportunity to take advantage of the interdisciplinary study at UCL, and I looked at everything from creative health through to the intersections with women's health, but also ethnicity, migration and health as well, and I think that that's a really important space for creative health to exist in. I've also been done some work around economic evaluations of creative health for the National Association of Social Prescribing, not something I'll probably ever want to do again, economic evaluation, but that's also been really useful in the kind of public health space, understanding that economic decision making that we've just been talking about quite a lot in the last panel. In terms of Worcestershire, and I think it's really important to say that Worcestershire is a predominantly rural county, and although it does have some urban centres, it's not something that I feel is fully reflective in the current creative health literature, and definitely not in the discussion this morning, and I think that's just because of the nature of the public health, the directors that we had here. So I'm really keen to talk more about the implications for rural communities, but also rural practitioners in terms of creative health. I also oversee kind of an existing creative health programme of work in Worcestershire, and that's a range of commission services, but also a more kind of community-led grant funding way, quite similar to what Justin was speaking about earlier, really led by the ideas of the community. And that's been really positive to see the change over the last couple of years in wanting to fund things like that locally. I've also been working a lot in the space of community stories, and I think that's a theme that's come out quite a lot today as well, in terms of evidencing that impact of public health and also the role of public health in people's health and well-being in a more qualitative way. So that's something else I've been doing in the last couple of years. And in terms of creative health more specifically in Worcestershire, we're kind of at the beginning of a journey, I would say, in terms of that collaboration between key partners in understanding and developing creative health in the county. So that's a really exciting place to be, linking in also with the Arts and Health Research Group at the University of Worcester. Just to summarise, my dissertation research project was actually into the enablers and barriers of creative health in rural settings, speaking to the gap that I just mentioned. I've just submitted that on Monday, so I'm feeling very relieved today. And I think, I'm sure we can discuss further, but a couple of things to pull out of that were that, number one, an absence of literature on creative health in rural settings, and are we doing a disservice to our rural populations in that? But also in terms of findings, rurality does exacerbate existing access issues, a different set of issues to urban populations, but I think it's something really important to consider around urban-rural inequality. And also massive barriers around the communication and signposting on a practitioner level, a strategic level, but also on a community level as well. But I'm really looking forward to discussing these things more. Thanks.
Hi everyone, thanks for sticking around for the second half. I really appreciate it, and I'm sure everybody else does on the panel. I'm Rachel Marsden. I wear many hats, so I'm going to try and keep it short, but also let you know a bit more about what I do. So my main hat at the moment is a really unique position through the National Institute of Health and Care Research and their School for Public Health. And they've recently had a series of transdisciplinary research placements where they invite people from non-health backgrounds to come in and do research as part of the School of Public Health. So I'll talk a little bit about that project in a minute. But I've recently got the follow-on 2-year fellowship, which is an exciting opportunity to continue the research I'm doing. And the 3 fellows all come from different backgrounds. So I'm arts and curating in its broadest sense. Contemporary arts and curating, probably a pinch of higher education and academia in there as well in terms of teaching. And the other 2 fellows actually come from landscape architecture and green and rural spaces as well. So it's going to be interesting to see how that work develops. That's based with the University of Birmingham and Keele University. So I know Stephen and Justin well, and have worked with them in the past. My other hat is with University of the Arts London, and I'm senior lecturer in academic practice there, so support the art design and communication projects of staff across the university. And it's a real privileged opportunity to gain insight into that work. We also have a health in art and design research hub there, and are currently developing a creative health group to bring together projects from students and staff to create a bit more of a research connection across all levels, all disciplines, all colleges. It's a bit of an idealistic idea, but we'll see what happens from that. But the project I did earlier this year as part of the transdisciplinary placement was mapping creative health assets in Stoke-on-Trent and Staffordshire, thinking about that intrinsic connection between creative health and public health, or in this case, a disconnection in Stoke-on-Trent and Staffordshire. It's much more established in other areas, such as Birmingham. And I really wanted to do much bigger mapping exercise, but time dictated it turning into very much just a skimming the surface scoping exercise of celebrating some of the brilliant practice that's happening in the region, doing a bit of a kind of a strategy analysis. It's very clear that culture would love to be more involved in health and are very aware of the health benefits of arts, culture, creativity, heritage, but public health is more so lacking of that articulation within their strategy documents or that involvement as well. Language has been a very important element too of that kind of, which came up at the end of the other panel discussion, the disconnect of language from either side. And so is there a shared language that we can create in the middle? And that comes into evaluation as well. Arts are very confident in evaluating in one way, health are very confident in evaluating another, but how can it come together? But then something that's really important to me, because of my own lived experience of dynamic disability, is actually how we put people first, citizens first within this work that we do. And always remember that and have that at heart, because ultimately, when we speak to them about creative health, they already know how they're engaging with creativity, so it's how to really kind of empower them to do that more. I'm going to be quiet now because I could talk for Brendan.
Brilliant, thank you. My name is Rob Dean. I guess a nice place to start is that for me, I'm someone who instantly recognised when I heard that term, creative health, the extent to which all the creativity that I've engaged in throughout my life, the really positive impact that it's had on my life through music, through drama, through dance, through all of those things. I've gone on through my life to be an associate professor in music and drama. I lead a research group called Art and Humanities for Health, which is across our entire university, so it's got people from all different backgrounds and disciplines contributing to that, which is really, really, really exciting. And I begin by saying that I recognise the important role that creativity has had in my life, because I think that's something that's been really important to bring to the research that we as academics do in that area, to ensure that it doesn't seem like, well, here I am, I'm the researcher and I'm going to investigate you and find out about you. I think it's important to establish that actually kind of, as the researcher, I have kind of skin in the game, and I've been there and I've experienced many, many kind of difficult times that creativity has helped me through. In terms of the key areas that I'm really, really focused on and interested in the moment. A lot of it does stem from social prescribing, particularly looking at the way in which the creative arts factors into social prescribing. One particular exciting project that we're a few years into now is working with our medical school to teach trainee doctors about creative health and social prescribing. So it's part of what they actually bring to the table when they become GPs. What's been really exciting about that is, as part of that particular module, they themselves take part in, let's call them creative health activities. And when they feed back about that, they say, oh yeah, I'd forgotten I enjoy these, and this really helps me, and it will help me as I go through my career as a student and go on to be a GP. So that's been quite just really rewarding work. The other thing that I'm very much focused on at the moment, and it's come up in the last panel and it's come up as we've gone along doing our introductions, is that role of evaluation and a sense that I have from the research that I've been doing and gathering that the metrics that we are using to identify whether or not creativity in these forms is having an impact or not just seems all wrong to me. It just seems all wrong. And from having numerous conversations, one-on-one, hour-long conversations with people that have engaged with social prescribing, particularly the creative aspects that offered them, it reveals the extent to which we are asking the wrong questions. So no wonder we're not getting the answers that actually really capture what is going on for people. I'll leave you with just a favourite example of this is the sense that if a particular intervention is working, then it reduces GP visits. That seems to be an absolute favourite one that's held up. I had a wonderful conversation with a chap, deep social anxiety, hadn't left the house for months and months and months. Finally, through social prescribing, he joined a book club. That meant that he had to get a bus to the book club. Getting the bus was massive for him. The book club was really engaging for him. He felt part of a community. He felt so confident, in fact, that the first thing he did was to make a very long overdue appointment at his GP. By that metric, it's had a negative impact on what it's supposed to do. And you will find examples of this throughout the way in which we're carrying out our data and capturing it. So that's something that I'm very passionate about. And lastly, I'm very fortunate to have just got a big wad of funding from the Arts and Humanities Research Council, which is why I asked the question before about international initiatives. So I'm about to begin something of a world tour, which is very exciting, across Canada, across America, through Japan, Singapore, Cambodia, throughout Europe, in order to find out what they're doing in terms of creative health, how they're evaluating it, where it fits into their health systems, and the aim of that will be to produce a report to give to the NHS and the people that were on the previous panel that I think have gone and say, this is what's going on elsewhere, and here are some of the wonderful things that I think we can be doing. You've got your own.
I think this will work. Thank you. Thank you. Hello, I'm Nuala Morse. I'm from the University of Leicester. I'm an associate professor in museum studies at the university. And thank you for the invitation, and part of why I'm here today is representing the University of Leicester and a newly launched Creative Health Network, which has the aims of bringing all of our research from across the disciplines and our different research expertise and strengths together into thinking about how the University of Leicester can also respond to the kind of creative health agenda through research collaborations and research initiatives. So the School of Museum Studies at the University of Leicester is the longest established School of Museum Studies. We've been around for about 60 years. And the research that I do there is really focused on how do museums and art galleries and heritage spaces, how do they play a part in wider healthcare provision? It was really wonderful in the panel before to hear all of the examples from Birmingham and all the work that's happening there with oral history collections and so on, and really in admiration of what colleagues have been doing out there. My work has been with museums across the countries, particularly in the North East and in Manchester and in Yorkshire. but really thinking about how can research support museums that are more and more looking to how they use their collections and their spaces to provide health and well-being interventions or programs or activities. How can research support cultural institutions to evidence that they're making an impact? So we could have a longer conversation about evaluation. I've done a lot of work trying to support colleagues in museums to think about how they might evaluate within a kind of health framework, and that we do ask the right questions, and what does that look like? And thinking more broadly about how museums might operate as community assets that care for their communities. The Creative Health Network is a very newly launched initiative. We launched just in July, and the aim, as I said, is to think about our varied research expertise across the University of Leicester and kind of bring that together so that we can think about where there are community collaborations around the kind of local priorities and local needs in the Leicestershire region. I should say the kind of initiative comes out of the Heritage Hub at the University of Leicester, and it's also sort of co-led with my colleague Sally Varnum, who's the Senior Manager for Creative Health and Heritage at University Hospitals of Leicester NHS Trust, and who's in the audience over here and will wave. Very well, thank you. And we'll probably do a bit of a two-parter. We'll probably answer questions on the panel from different places, because we kind of come as one today. The Creative Health Network at Leicester aims to bring together, as I said, our different institutes and research centres. So that includes the Institute for Precision Health, the Institute for Environmental Futures, the Institute for Policy, and some of our key research centres, such as the Centre for Ethnic Health, the Centre for Diabetes Research, the Centre for Rights and Equality in Health Law, and the Centre for Empathetic Healthcare, amongst others. I've probably forgotten some, but a real kind of diversity of expertise there. We're hoping to have a community event on the 30th of October, and some of you might be interested in kind of joining us there. And it's really to think about that question of how do we develop creative health for Leicester and Leicestershire. So what are the local priorities, and how do we, as a university that has a commitment to civic engagement, how do we kind of respond and share our research resources and spaces and kind of have a meaningful engagement in that conversation around creative health.
Just quickly before I ask some questions, I'll introduce a bit about my background as well. So prior to my current role, I was doing a PhD in creative health at De Montfort University. So I created a framework of communication there for people working in mental health and well-being. I'm currently converting that PhD into a book with Routledge. I'll be handing the manuscript in next month, so that should be out soon for anybody that's interested in that. My current role at NCCH is the Midlands Creative Health Associate. That means I represent 11 ICSs across the Midlands region, trying to connect up networks and advocate for creative practice in senior health systems. So that's the kind of point of view that I'm coming to this discussion from. And I think one of the reasons why I was really passionate about having this panel added to the event today is because I feel like I'm in a very privileged position, having been the Midlands Creative Health Associate, in that I am now very connected across the Midlands, and thinking about the legacy of these regional posts, which are currently due to finish in March. I want to make sure that that network is self-sustaining and is able to keep connected beyond my presence there. And so I want to be thinking about how we empower that network to be self-sustaining. And I think one of the really important aspects of that is making sure that research and this local evidence base is able to be connected into those senior leaders that are now part of our Champions Network. So I guess my first question along those lines then is how do you currently feel in terms of your network reach, and how do you think that this might shift that paradigm moving forward if there was some kind of research network established?
So I think when we talk about the Midlands, we have to be so aware that that's such a vast part of the country, and actually it's really diverse, not just in terms of ethnicity and population, but also, demographics or geographic as well. So I think there's also creative health is much more developed in some places rather than others. I think everyone's kind of alluded to that today, and I think I would certainly feel the value of being involved in something in the Midlands, because I think Worcestershire's a little at the beginning of its journey around creative health, but also I think linking up between the academic institutions as well. Obviously I work in local authority, which is quite a different world to academia in a lot of ways, and I think having something that can create the links between academic and local authority public health in relation to creative health, not just NHS and integrated care systems, because I think that it's missed out a little bit in terms of that local authority element on the ground. I would say that public health probably has more kind of on-the-ground community work opportunity to engage with communities, especially in terms of prevention. So I think that would be really beneficial to be looped into that academically as well.
Something that's been quite interesting to really hone in and listen to as part of the mapping creative health assets work in Stoke-on-Trent has been talking about potentially developing, so this is kind of thinking about the outcomes of that and how it might impact this, developing a creative health network just for Stoke-on-Trent. But there's actually a lot of apprehension and kind of a little bit of reticence, because some of that is asking why do we need another network? It's thinking about capacity and resource, and imagining that a lot of those people are in precarious positions as well. Also thinking about, well, what are the outcomes? What are the outputs and outcomes from a network? What's it working towards? So there was kind of met with this apprehension that I too also have about the development of new networks, also because of being time and capacity poor, but also being part of other networks. So for example, I'm West Midlands champion for the Culture, Health and Wellbeing Alliance, which I forgot to share, which is like the sibling in a way to the NCCH. But being part of that network alone, where we kind of draw on all our groups' experiences that they're having in other networks, so it's a bit of a kind of snowballing and cascading effect. It's really helpful to bring together that shared knowledge in a space, but we're also really mindful that often comes at a additional ask on top of work and things that other people are doing. So I can see there are these, I think, really important benefits as to having these networks, but I think it's valuable to ask those questions before, so it's done in the right kind of vein.
For me, I think it's there are many benefits to these kinds of networks, but I think for me the key thing is to do with identifying challenges and sharing how those challenges were overcome or not overcome. What I do find with the kind of connections that I have, and when I go to social prescribing events, particularly and creative health events, is I might talk about a project that we tried to get off the ground that failed, and the person I'm talking to will go, "Oh yeah, we tried that, it failed too." And we go, "Oh, okay, well, if I'd have known that in advance, then I could have learned from what went wrong with yours, and we could put our heads together to be able to approach it in a slightly different way." And that was really sparked off when you mentioned mapping assets. I think if you looked across the country, the amount of attempts to map these assets will be astronomical. I think even in Lincolnshire alone, I think there's been 3 separate goes at it by 3 separate organisations, and so I just think the network is about a way of identifying, and also it helps to avoid that kind of reinventing the wheel each time there's a new idea.
I absolutely agree. I think at NCCH we were tasked with mapping local assets, but we're given the freedom to define what that meant. And one of the very initial conversations was mapping artistic assets, for example, because that scene shifts so regularly. Who's going to keep up that database? Who's going to keep up that updating of it when our role is not there or when our capacity is overstretched? But then what do we do in the absence of that connection to public health teams who are saying, who can I connect to? And I went to a really great
training session by Glasgow University recently, who looked at network analysis and how sometimes having those databases, even if that person is no longer delivering it, they will know the people that you need to know. So there is some value in mapping, even if that map becomes outdated. Being closer to the art scene from a public health point of view is still a value. But like you say, being able to learn from those kind of insights is really important. Did you have something to add?
I think it echoes that. I think one of the needs that the Leicester Network is responding to is that people were just having difficulties finding each other, and that's within the university itself. So, where do I find someone who's a stroke specialist to help me think about how we do this, dance intervention? And we have a website, but actually we just weren't finding each other. So So for us, it's about kind of responding to that need and also finding us more publicly available to people who want to come to the university and are looking for specific health expertise or creative health expertise, so that we might kind of come together around research collaborations. And I suppose the way the kind of university world operates is sometimes really long time scales, and you can have time to build partnerships over years and find the right grant and develop that project. And sometimes it's such quick response that we need to find each other really quickly in order to kind of meet a deadline for a funding call. And I think we're seeing that more and more. So there was kind of expediency as well in kind of creating these networks for us. I think there's a kind of question of scale always, isn't it, that comes back to your point about the region and the Midlands. And I think I probably see the value in sub-regional and regional, and maybe they have different aims, but certainly I would feel that there's huge value to connect into that unit. If it's a unit, I suppose it makes sense for how the conversation is going, for maybe funding or policy, or which I think it is, but I suppose it's about understanding what does a unit reflect within a public health conversation, or within a local council conversation, or within any kind of higher education kind of conversation.
Yeah, I can only agree with everything that everyone shared, and just add, especially for me in my new role, it's only a positive, as an early career researcher, but then also, looking specifically within, the practices of dance, music, and nature. The arts are so broad, so if we look at all the practice-specific things, so it's nice to have a signpost as to where to find these people to connect with and strengthen our practices, and like you said, not reinvent the wheel, because I think I'm from Wales originally. I know Wahoon, which is the Welsh and Arts Health and Wellbeing Network. They have a really open communication across all the regions, so they're not, they're trying to avoid that. I think it would only be positive, and it's just about setting boundaries as to how much expectation there is within the network to contribute.
Yeah, absolutely. So one of the things that kind of sparked my enthusiasm for actually moving forward with this conversation was Stephen Gunther, who was part of the last panel, said that he was kind of trying to do that on a local level of connecting with the universities to improve the connection to that evidence base and driving some of that creative health evidence. And what I found was that kind of contrasted to an idea in my head where in our roles we have to be very careful of we're connecting to these senior leaders, but that doesn't mean we can open that gate to everyone that contacts us, and trying to be balance the inclusivity whilst understanding that they're busy people with limited capacity, and how do we organise that so the right people are having the right conversations at the right time. I guess kind of ruminating on that, I'd love to hear more. There was an example in the last panel about how having the right person in the room shifted the conversation. Who do you think the right people are? Where do you have any kind of gut reactions of where the boundaries would be? And what do you think what exists? What is that contribution that we're hoping to offer as a consequence of this network?
I don't mind starting. I said it in my opener. The voice of lived experience. I think citizens, those who are not only engaging in creative health, but they are leading creative health in their hyperlocal communities. They understand the needs, often more so than public health in a way. And for me, they're always the voice that can cut through a room, can say something that you will remember and won't forget from that occasion, and can really be the catalyst behind, I think, certainly within some of the research projects that I've been part of, have been catalysts for some of the kind of key change or key priorities that can happen within a project. So I think within a research network or a research environment, that's paramount for me.
Yeah, and I'd add to that, and I think, so I am totally agreeing with you, but at the same time, at the same time, sometimes we as academics need to be the people that put those voices in the room, in as much as a lot of the work and the research that I've been doing has been speaking to people with lived experience who would absolutely not turn up to some meeting and talk in any wider forum about what they've got going on, what their experience is. And so I think it's important that we, in the positions that we're in, are able to bring those voices into that room to make sure that they're heard. We're kind of like we've got the microphone in that sense. And to kind of not answer the question but flip it around, I think one of the struggles that I've had has been when the people that I don't want in the room are in the room and the ones that hold a lot of the power. There's been a couple of projects that have almost got across the line, but they just needed the extra nudge from an NHS commissioner, for instance, who fundamentally thinks you should medicate and not use creativity. That's the bottom line. And regardless of what evidence was presented, from the minute I was in that meeting, I knew I was just up against a brick wall. And so I think there's something to be done, and I don't know what it is, that I think a network could really help with, is actually finding those advocates on the inside of the system that we're trying to change.
Yeah, completely. Just over the weekend, I attended a Taste Tai Chi session that we were running at MAC, and one of the participants was a GP, because that's something she's championing, and it's a passion project for her, who they've developed their own literature review around the health and wellbeing benefits of Tai Chi as movement practice. So those people there, they're wanting to be champions. Again, perhaps with a research network, it's actually about the interdisciplinary of bringing those people on board to continue the conversation and to see how those pathways can really connect in the system.
I would just say that I think from an academic research perspective, one of the strengths of this whole area is around interdisciplinarity. And so, and you mentioned boundaries, and I don't want to pick up on it, but in a way I would be totally open to whoever wants to be in the room. And, when you have a chemist working with a dance professor, working with, a kind of dance practitioner, and working with a group with lived experience, suddenly, it's those kind of interdisciplinary and cross-disciplinary and cross-boundary conversations where the real kind of ingenuity comes out of. I suppose thinking back on that conversation, who needed to be in that room at that public health conversation where creativity was there, we do need to kind of think about artists and the role of artists, and kind of really valuing those skills and expertise that they bring in the room, and not taking them for granted, or really thinking quite carefully about that kind of expertise as well, which I think we all agreed on, but hasn't come up yet necessarily in our conversation. So I just wanted to kind of nod to it as a kind of really valuable voice. And how do we get it in there when there's necessarily some hierarchies of value about people's expertise when you're in those decision-making fora?
Just quickly, kind of building on that, do you, when you're creating your new research projects, do you find that you're often coming up with the project and then going to those communities, or is there any existing provisions at the moment where artists come to you and go, we want to be able to evaluate what we're doing, and that turns into a research project? that's open to everyone.
Yeah, I want to answer just really quickly. I think one of the challenges that we have one of the challenges as I perceive it is kind of one of scale and priorities. So it's very challenging for me to work directly with an artist to evaluate a small scale project, because I am expected to be putting in grants for 300 to £1 million, and that's the kind of scale of the expectations of the university in relation to my role. So we always come up with clever ways of doing these things, but there's an issue of scale there, I think, But the other question, I think, which was about, I think all of my work and lots of colleagues that I work with, and a lot of the university model is around co-production. So it's absolutely about understanding what the community issues and community priorities and community challenges, whether they're health inequalities or just interests in the community, and starting there in order to identify your research questions. And from the Research Council's perspectives, that's what they're looking for. They're looking for co-production, they're looking for lived experience, and they're looking for meaningful engagement within any kind of academic bids. I don't think the ones that are kind of, well, we've got an idea and then we'll find somewhere to do it, those aren't being funded anymore. But there's been a real kind of, I would say, a paradigm shift in the last kind of 10 years in the way academic research is funded, for sure, yeah.
I would just, I think reading into two words that you use there, clever ways. Yeah, we can find clever ways of doing it. I get approached by different arts-based organisations about a project that they want to do, and would I be able to be involved in it? And there is, I feel very aware there's cameras on me at the moment, and there's many ways in which that can be achieved. One is, I can go and speak to our business and research funding manager. He can speak to the artists and then come back to them and say, yes, Rob Dean can be involved. It'll cost £40,000 for this amount of his time. Or there are clever ways in which we can do it, and we have that conversation and work out what actually is it they need, to what extent is it about getting that letter of support, is it about actually the university providing some of its facilities, particularly over summer, which tend to be empty. Are there other ways around it that the university can support this research? It can go into the funding bid, and the price tag is much smaller.
I was going to bring in a different perspective in that, so thinking about who should be in the room, I was thinking about commissioners as well. So research is often dictated by the funders, by the commissioners, as to what their priorities and interests are. I don't want to say that research often gets shoehorned into that. I've just said it. But it can often be the case that I think, and I would say this is, I'd say this is if we see creative health as a trend, you can see that reflected within art galleries, museums trying to develop a practice within it. I think there are pros and cons to that, but I think that happens with any kind of rise of a sector and a discipline, that it happens, and I think that's reflected within the commissioning as well. So that there is often within research, we're trying to find a way to fight for this, big pot of money that is out there in the world that we have very little percentage of getting. But within that, there is an opportunity, I think, to then go back and ask communities, ask individuals what their priorities and what their needs are, to make sure that is part of the funding, and that funding can be drawn down to support and pilot projects in that way. I could talk about it forever, but I have a real, and I think probably a lot of researchers do, when you sit in that space of writing funding applications, of a real wrestle within that, of when you're trying to meet multiple needs, and that often, I wouldn't say that's just within research, but to try and meet all that they're asking within their bids, which kind of lacks a bit of flexibility and freedom to really test the interdisciplinarity or transdisciplinarity of a project, and give you that freedom as well with all the stakeholders and partners and individuals that you're working with, to just see what happens. It's always about evaluation and the economics of it, and it can feel very held, rather than giving a bit more space.
I guess I kind of think of research with two hats on in my role. So obviously academic research, early career researcher, and all the things that we've been talking about, but also as a kind of advanced public health practitioner working in local authority. We talk about community research a lot, and okay, it's not got the backbone of the kind of academic processes that we're talking about, but actually we're consistently engaging with our populations on what is meaningful to them through a variety of different mechanisms, whether that's health and wellbeing consultations, viewpoint panel surveys, a variety of different means. And I think that actually, I do commission services, and I'm really lucky to have had support to be able to commission kind of ethnographic studies or different pieces of creative work. So I feel really grateful for that. But I think we can also think about research in that sense too. Like, it doesn't just have to be what's going on in universities, because actually, like, local authority or community, voluntary community sector, faith sector organisations are actually doing this already. So making sure they're in the room and they're represented in the conversation, and actually or maybe not being so rigid about the academic side of research, I feel like we could probably get, well, it's applied really, and I think that's something that I would be really keen to see is actually it's the application, because all of this research is great, but I can tell you that definitely people in a community aren't going to care whether it's transdisciplinary or interdisciplinary. They're just going to care about the impact on health and wellbeing locally, and I think we can get a bit het up in that sometimes, and it's quite grounding actually to remain kind of working in practice in public health, because ultimately we're that gateway to the community, and we're always thinking about the way to protect, improve their health. So I think there's definitely something to be, I don't have the answer, but explored or developed there in terms of who's in the room.
And just to add to that, thank you for setting that for me, because I was just going to kind of put the attention, I guess, on the role, the created role like mine, which Birmingham City Council, Public Health have funded, because they've seen an opportunity and a value in putting people full-time in a community asset to capture community voices and through their different creative practices. So it's a really exciting nod to that, and they've been so innovative in setting that up. So maybe the role will be called something different in the future, but I think it's definitely worth commissioning. Keep commissioning it.
No, absolutely, and some of the things that's coming up in my mind as well is things like the health and innovation networks in the NHS. It might be that all we achieve by connecting them to the network is putting it on their agenda. They don't need to keep interacting at a deeper level than that, but knowing that creative health exists is really important. And one of the networks that I'm thinking of in my brain whilst this conversation is happening is the Sherpa network, which is across Shropshire, Telford and Wrekin, but also Staffordshire and Stoke-on-Trent. And whilst there is a lot of academic institutions in that, one of the really things that excites me about it is that the ICB are also part of that. So by having that integrated care board in there, they're also then able to bring in community assets, kind of give those letters of support that make the funding more likely. And I think one of the things that I wanted to achieve via this network is that when these really big national pots come out, the Midlands have some weight behind us. We're able to quickly assemble and create that application when given 3-4 weeks notice. So I guess potentially my final question, based on the time, is do you think that network is best served as a place to meet and discuss, or is it more about having some kind of directory so that the right people can connect with each other when the time comes up that they want to connect? Or a mixture of the above?
I'm going to throw something else in there. I always think networks are helpful for an updating on what's happening now. So to hear from people in terms of what they're working on or what they're thinking about, because that's seeding of ideas to then make sure that there's cross-pollination in the right way and there's not duplication of projects, or that you can make research far more meaningful through that, I think is really important. And it's often when I go into networks that, you come across somebody that you're like, either I wish I'd spoken to them 6 months ago or a year ago because you would have been perfect for X, or no, you're the right person I need to speak to now because you could either open the door to somewhere or somebody that I need to speak to, or that you could be really integral to the next step of a project. So I suppose that's an addition rather than speaking to those two areas. I think the directory is always helpful, but it's that upkeep, who's responsible, the maintenance, GDPR, all those kind of elements.
I can't handle silences. There's this one thing that's been on my mind, and I think it was the person's question right at the back about pulling the big lever. Is that right? And it's been really kind of playing on my mind. And so I guess all I've got to add is I think all of those things that have been said would be useful for the network. But if there is a big lever to pull, then as a network, we can get together and all be pulling on that lever. And my interpretation of your question was that have we not collected enough information to be able to say, right, this is just now going to become part of what healthcare is. We don't need to keep looking at it. It's just going to happen. And I think that as a network together, we can all be pushing for that. So it's kind of, let's stop evaluating. Let's just get it done and get it action. I think that was what your hand gesture indicates. Yes, that's what I was talking about. And so that, would be the strength of the network, is to be able to, as one kind of unified body, get behind that lever and give it a pull to make sure that these things get just set, and they are, rather than it being, this is something that's being explored, because maybe it works. Well, it works. Let's get it in and part of healthcare.
I think something else I would add, is about the sharing of findings. And I think that it can be really hard to get your hands on something which is kind of straightforward. This is what we know about that. And I know the NCCH have done an amazing job of summarising evidence, as have other partners. But I think if you could have something that was a bit more regional, I guess, but also, considering communities of experience and identity that Justin was talking about earlier, I think, okay, I'm doing this and I want to know, has anybody else done this? Actually, where can I find something really summarised of all of that research in relation to that? Because I think as well, it can be that how we then share that findings at a more local level, whether that's political, whether that's strategic, or whether that's community. It always has to go through a level of kind of reconditioning into something that's appropriate for that place. But I think having a kind of central, that doesn't exist already, does it? A central kind of creative health? No. Or way of accessing. It's a really difficult task, right? It's the endless task of updating and everything.
So our Southwest associate has managed to get it so that there is now a creative health category in libraries, so you are able to look through resources or suggest that they add those resources to there. That's the closest there is down to the central point.
I was just going to say, it's making me think about what you said before, though, about around accessibility, right? All this research is happening, but how accessible is it to be put into applied use? And the importance of, so with many of the assets, cultural organisations that I've been working with in VCF sector, a lot of them want the data, they want the information, but they just don't know how to get it or where it is, but then also how to translate it into their context so it can be used and capitalised on appropriately. So I think that first step is around that repository, that space for all that evidence, but then how is it drawn down so that it can be used in the right way?
Yeah, I think that, to pick up on your point, that would be so helpful. Such a wonderful role of the network to be. I mentioned that meeting that I had with an NHS commissioner. If before that I could reach out to the network and go, this is the meeting I'm going, these are the questions and I'm going to be asked. Can you help me build my case? Yes, this. That could be a really, really helpful resource for sure.
I really enjoyed that conversation about pulling the lever. I think at the university, we really want to kind of better understand what our civic role is, and I suppose we do research, but we also have a huge student population. We do lots of public engagement with research. We have an art gallery. We have a library that has special collections, has display spaces that we use with the community. The Heritage Hub, where the Creative Health Network sits within, is about sharing our heritage expertise and supporting community heritage across Leicester and the region. So it's a shame to boil us down to research, and maybe I did that inadvertently. So, but I think we also want to be an asset or somewhere within that conversation and see how we can galvanise action. I think it's also for us making ourselves more visible so that we can be utilised as an asset that is here.
I also want to quickly say, as researchers in universities, and I don't know if colleagues here will feel the same, we want to pull the lever and we want to do it much quicker than we often are allowed to, but the systems and the structures of the institution don't let us. And they're there for a reason. Like, from an ethical point of view, I completely advocate for the ethical processes that we have to go through, but some of the things can mean that it can take a lot longer to do what we want to do and to activate and action what we want to do in the ways, at the speed that we want to, and that can be a bit of a hurdle, I think, so that when that phrase for me sits in the back of my mind, because it's come up in previous events that I've been part of, in terms of like wanting to do research, but then not understanding that can sometimes come at quite a slower pace, although sometimes it doesn't feel slow when you're in it at the same time when you've got a deadline.
A mixture of ideas that are coming through to me, but I guess like with the benefit of having the network and touching upon something that Justin Verney mentioned earlier about, creative health and that role of communication, and how as researchers, the way like we disseminate the information, and if we're working really co-productively in our communities and it's community-led research, like what's that full cycle, feedback loop. So like how we actually put best practice into the way that then we're disseminating, that people have continued voices, that creativity is involved in the actual creative reflective evaluation, whatever you want to call it, but that's also a key ingredient within it.
I know we're basically at time, but I have one quick question, so if you can keep the answers as succinct as possible. But we mentioned capacity as well, and I know that one of the concerns that NCCH has of starting these conversations is whether, as an organisation, we have capacity to hold this moving forward. What are your thoughts on how researchers who also have limited capacity, who might hold this network? Would it be a sharing of responsibility in terms of facilitating or moving things forward? Or do you think that really we need that funding, we need that role of a leader?
I think that you need a central role to hold it all together. I think you can still have varying levels of involvement from people at different stages, sharing, chairing, or updating, or whatever. But I think ultimately there does need to be the responsibility of keeping it going somewhere. That would be my view.
Definitely. Just from what I've observed in other programs in the past, like you need a coordinator and a driver to keep it, alive and well.
I possibly agree. I also think that you want to expand that conversation into what the aims of that network are, and they can be quite short term, and sometimes networks only need to exist for a year to galvanise something, and then they splinter off and things happen, as long as like that aim is clear and we've understood what lever or what action we want to collectively kind of come out of it. So for me, I wonder if that's the first question in terms of, what is that kind of key aim that's maybe realistic and achievable, and then maybe it can work without funding, because I think we are all working in a kind of lack of capacity. But also what I would say is that I am kind of continuously galvanised by how much energy there is in the room at this precise moment, and I feel we have to kind of jump on that to make something happen. Like the moment feels like it's now, and NCCH has been kind of testament to that and the driving force of it. So thank you.
Thank you so much.
I'd say, get funding, get someone in, get someone running it, and this is a slightly provocative thing to say. I wonder if this conversation was about anything other than the creative arts, we'd even be considering that we would do it without funding if it was another area. And I think about the conversations I have with my students when they graduate. This is your art form. This is what you do. Get paid for it. And so I'm just underlining that, I think.
No, absolutely, I agree. And I think that one of the reasons why I wanted to have this panel, despite that kind of uncertainty around it all, is the more I can create that public platform of this going as a video on our site, all those people who are interested in being that host, or interested in funding, or interested in continuing that conversation with ideas, know where to go to continue it. So thank you for starting that off for us, and I hope that people will continue that conversation beyond today's event. Thank you to our audience as well for coming. If we could give a round of applause for our final panel.